I'm thrilled to welcome you to tonight's Medicare for All statewide town hall meeting, and it is co-led by the Students for a National Health Program here in Florida. In the next hour, we're going to hear from physicians, medical students, experts, as well as key legislators who about why we need to fight back against the privatization of Medicare and why we need to ultimately move toward an improved Medicare for All program. We also want to share ways to take action. And so all of us can make a difference, really feel like we're making a difference to protect our public health program and get closer and closer to our ultimate goal of universal health care. We hope that tonight's town hall will strengthen the movement here in Florida to fight against the privatization of healthcare and to work for a better healthcare future. I want to thank in advance everyone who has helped make tonight's event possible. Angie, I'll go to the next slide. I definitely want to thank those 21 co-sponsors that are there on the screen tonight. If you're with one of those, any one of those organizations, it would be great to give us a shout out in the chat if you would. That would be so great. And again, thanks to all of those co-sponsors. And now I'm going to hand it over to Artemisa.
Thanks, Candy. Hello, everyone. My name is Artemisa Kula. I'm a fourth-year medical student and a member of Students for a National Health Program at the University of Florida. As part of tonight's town hall, we are honored to hear from Congresswoman Pramila Jayapal, as well as from Congresswoman Sheila Cherfilus-McCormick of Florida's 20th Congressional District. While the Congresspeople could not join us on this call due to scheduling, they recorded video messages to show their solidarity in this fight. Tonight, we'll also hear from community leaders in the fight for health justice, and we'll learn about how activists are building power from the ground up to protect our public health programs and working to improve them so that eventually we will have Medicare for all. In tonight's webinar, only the panelists can speak, but we do want you to interact with us. So please put your name, pronouns, where you're from in the chat. Also tell us what motivates you to want to fight back against insurers denying us care, and why you want to protect and improve traditional Medicare. Now it's my pleasure to introduce the video message from Congresswoman Jayapal. We're thrilled, even though she could not join us tonight, she recorded individualized opening remarks to kick off tonight's program. Congresswoman Jayapal represents Washington's 7th Congressional District, having first been elected to Congress in 2017. Since 2019, she has introduced the Medicare for All Act in each Congress, which is the bill that would make universal healthcare a reality in America. Every year, she also circulates a letter to CMS to sound the alarm about the privatization of our existing Medicare program and the overpayments and harms caused by these so-called Medicare Advantage plans. Since 2021, Congresswoman Jayapal has served as the chair of the powerful Congressional Progressive Caucus, and she's also the first Indian American woman to serve in the U.S. House of Representatives. Now let's start off our town hall with the opening remarks by Congresswoman Pramila Jayapal.
I'm Congresswoman Pramila Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you to Medicare for All Florida, Physicians for a National Health Program, and Students for a National Health Program for inviting me to share a few words with you today as you open your town hall. As many of you may know, I am proud to lead the movement for Medicare for All in Congress. My Medicare for All Act is the country's most comprehensive plan to transition to a single-payer universal healthcare system that finally puts people over profits. After first introducing this comprehensive bill in the House back in 2019, I was able to secure the first hearings ever in the House of Representatives in 2020. And each year we have continued to build support, culminating in 2023 when we got more than half of the Democratic caucus, 112 members, to sign on as co-sponsors, including many of our powerful committee ranking members. And while that movement is about expanding our healthcare system, we also need to focus on defending the current system from attacks, especially under the Trump administration. I'm talking about their efforts to privatize Medicare. Medicare is a critical piece of our healthcare system, and it's one of the few pieces that actually works. It provides care and services to more than 66 million Americans every single day. But Republicans want to dismantle this program, hand it over to private insurance companies who only care about profits. Privatizing Medicare is a terrible idea, period. And it's one that I am going to fight tooth and nail. And the most prominent form of privatization is Medicare Advantage, or as I like to call it, Medicare Disadvantage. These disadvantage programs take shortcuts, too often leading to worse outcomes and higher costs. They are profit-driven entities that encroach on Medicare and our entire healthcare system, aiming to make money off of both patients and the federal government. We have to do better than inappropriate delays, denials of care, and unnecessary red tape that slows down the ability of providers to offer critical services. That's why I've made it my mission to call out these plans as the scams that they really are. They use deceptive advertising like upfront discounts with $0 premiums to trick people into enrolling, but then after that, seniors end up with worse benefits and outcomes for higher costs. Last year, I had a constituent in my district who called my office not knowing what to do. She was trapped in a terrible Medicare Disadvantage plan. For almost 2 months, despite numerous calls and emails, she could not get off the plan and back to the benefits that she needed. With my casework team's assistance, my constituent was about to get off the Medicare Disadvantage plan, but then Aetna reinstated her coverage effective for the wrong date, meaning that she would have a lapse in coverage. We got in touch with Centers for Medicare and Medicaid Services, CMS, who reached out to Aetna to directly fix the error. But I have seen far too many seniors run into problems just like these, which is why I've repeatedly called on CMS to enact urgent reforms to Medicare Disadvantage plans. Last year, I led 60 lawmakers in urging the administration to crack down on these schemes and reinvest in traditional Medicare. That was just one of the many letters I've sent to CMS urging them to eliminate the barriers to care caused by these private for-profit Medicare Disadvantage plan policies, to stop overpayments, and to reinvest the savings of time and money into expanded care for Medicare beneficiaries. We can't keep letting these private insurance plans run amok and overcharge us for care and rip off patients and waste taxpayer dollars. Our seniors deserve better. That's why I'm fighting to expand Medicare, to include dental, vision, and hearing, to stop the privatization of Medicare through Medicare Disadvantage, and to lower the age of Medicare eligibility so more seniors can access affordable, quality health care. I'm not going to lie. We're going to need you in full force right now, because the Trump administration has other plans. They intend to privatize Medicare by allowing private health insurance companies to completely take over the system so that they can continue to deny and defend and depose you and deny you your ability to access health care. Trump intends to increase profits for giant CEOs and corporations and make you pay more for it out of your pocket. He intends to stop you from seeing the doctors of your choice, to deny you critical care, and to sue you when you try to resist. So, I promise you, we will fight this, and we simply cannot do it without you. Your work is more critical than ever. We need to build the movement, educate the public about the Republican ripoff of taxpayers. We need you to continue rallying, making phone calls, giving us stories that show what they are doing to the American people. We need you to write letters to the editor, to use every means of communication you have, to call your members of Congress, especially your Republican members, and make sure that they understand that you are not going to stand by silently as they privatize and slash Medicare. So, let's do this. Let's save and expand Medicare, because healthcare is a human right, and we are going to fight to make sure that everybody is in and nobody is out.
That video was amazing. I loved how Congresswoman Jayapal also specifically recognized us here as healthcare activists in Florida. My name is Stefan Ramdor, and I'm currently serving as the chair of the all-volunteer nonprofit organization Medicare for All Florida. So later in the town hall, we hear more specifically about that letter sounding the alarm on the so-called Advantage plans, which Congresswoman Jayapal is about to release again, and which now more Congress people can sign on to. But now it's time to bring in our next speaker. It's an absolute honor for me to be able to introduce former State Senator Dwight M. Bullard. He has an impressive resume as a high school teacher, as a state legislator, and now as a senior political advisor at Florida Rising. Throughout Dwight's career, he has shown a consistent dedication to empowering people and to amplifying the voices of those who are often unheard. So I'm really looking forward to what he has to say on the issue of healthcare. Welcome, Dwight.
Thank you, Stefan, for the invitation and the pressure that you put on me. I appreciate that even more. No, it's always good to be amongst other advocates from around the state, especially on this issue. I had the pleasure and honor of being on this call a couple years ago. And it's good to see so many folks locked in for the fight. You know, as someone who sits on way too many Zoom meetings, anytime you can get over 100 people after 7 o'clock on a weekday into this one space, it really does my heart good. You know, what Congresswoman Jayapal touched on, I'll lean in a little bit further on. Robert Reich uses, who used to be former President Clinton's labor secretary, uses the term that there is a coup happening in the federal government at this moment. So I like that language because it really does shape the urgency of the moment. We're allowing oligarchs, billionaires, and bureaucrats who are really unqualified to take over and grift us as taxpayers out of money, all by trying to use privatization and the attacks on what they're calling DEI and other things to really undermine the goal of any government. As a former state legislator, government's first and last job should be the protection of its citizens. Let me say that again for those who may have skipped civics or American government. Government's first and last job should be to protect its citizens. Full stop. So when we're talking about the attack on Medicare, the attack on Medicaid, the privatization of these industries, and the ultimate grift and return of money to these billionaires, these companies that are really out to do us harm, unfortunately, we really have to take the reins back. I'd be remiss as a former high school teacher in the midst of Black History Month without grounding us in the fact that the reason we do not have universal health care at this point in this country is because people did not want to give free health care to the sons and daughters of the formerly enslaved. That is not hyperbole. That is unfortunate factual reality that in the three times that we've talked about universal health care post-Civil War, where Congress actually had the agency and desire to want to do something, part of what stopped those efforts was the inability to figure out how to carve out people of color. And so that is the backdrop from which we are taking on this fight. So I just want to remind folks, just very briefly, that you're not alone in this fight. Advocacy organizations like Florida Rising and so many other organizations that are on this call are trying to get people in front of the legislators that they're too often fearful to engage with. I can say this as a former legislator. A lot of those folks don't know much. More importantly, they don't know your story. They don't know what you're being impacted by on each and every given day. They don't fully appreciate that 80 to 90% of Americans are one catastrophic illness away from bankruptcy. These are the realities of the world in which we live in. So we can't allow ourselves to backslide into a world of privatization. We have to move forward. If there is going to be a ballot initiative in the coming years around Medicaid expansion here in Florida, not only must we sign those petitions, we must pass that to protect our Floridians here in the country. We want to send a clear message to the Trump administration or any other administration that the people of this country want to protect one another from catastrophic illness, from bankruptcy, and so many things that come as a result of these changes to medical insurance. And more importantly, we want to send a clear message that regardless of people's condition, status, orientation, ethnic background, gender identity in this country, everyone deserves fair, equitable, and I'm just going to go ahead and say it, free healthcare. But if we can't get free, we're going to get damn near as close as we can to something that is a protective mechanism of us all. So again, Florida Rising stays committed to lock arms with everyone on this call until we see this thing get done. Because whether it's housing, whether it's gender justice, whether it's expansion of democracy, we can't do any of those things if we're sick at the end of the day. And so healthcare is paramount. Healthcare is integral, and healthcare is interconnected to any expansion of democracy that we see moving forward in this country. So again, I've dropped the Florida Rising information in the chat. I look forward to, again, standing in full solidarity and 10 toes down with each and every one of you as we try to fight each and every day to not only stop privatization, but to expand Medicaid for all. Thank you, Stefan.
Thank you so much, Senator. So we're now delighted to welcome our next speaker, Dr. Frederick Southwick, a professor of medicine at the University of Florida in Gainesville. In January 2017, Dr. Southwick was appointed Director of Patient Care Quality and Safety at the Division of Hospitalist Medicine at UF, and he serves as a member of the steering committee for the Right Care Alliance in Gainesville. He's here tonight to share his personal experiences with the so-called Advantage plans. Dr. Southwick, the floor is yours.
Thank you, Artemisa. I want to give you a little story about, as a physician who should know better, I made the mistake of listening to a friend who was a salesman who definitively stated that Blue Cross Blue Shield Medicare Advantage was the way to go when I joined Medicare. He never mentioned the possibility of Medicare with gap insurance, and I trusted him. Little did I know he would be receiving a commission every year I stayed in the program. Our premium for Medicare Advantage was only $56 a month, and initially the copay for office visits was only $25. No one mentioned deductibles when I signed up in 2014. I was told the most medications would be free and hospitalization costs were covered. However, copay increased to $50 per visit, and a deductible over the 4 past years has increased to $6,000 a year. That meant before Advantage program paid for any hospitalization procedure, I had to reach that deductible. I've owed $6,000 annually for the past 4 years. Also, I have an above-the-knee amputation caused by a surgical error. And in September 2024, my electronic prosthesis wore out and was past warranty. I applied to Blue Cross Blue Shield to approve a replacement, and they refused. I had to use an electric scooter. I was constantly worried about falling. And fortunately, I never got hurt or fell seriously, and it took me 3 months of letter writing to get a new out-of-box prosthesis approved. Despite my unhappiness with this policy, I could not return to straight Medicare because after 1 year on the Advantage program, all gap insurance plans can demand you list all preconditions, resulting in higher premiums or outright refusal for coverage. Fortunately, this Medicare Advantage policy was canceled in January 1st of this year, and I received a letter telling me I could obtain gap insurance without having to declare preconditions, and now we are covered with regular Medicare. no more copays for office visits, and no deductibles. And I pay $400 per month for gap insurance. That means I will now pay $4,800 per year, far cheaper than my Medicare Advantage that with copays and deductibles average annual expenses of $8,000 to $10,000 per year. I am one of hundreds and hundreds of citizens in my district who have been trapped into Medicare Advantage. I'm a physician who should have known better and understood the consequences of joining this deceptive insurance program. I was fooled, as are many seniors throughout the country. Now I'd like to introduce Dr. Leo Alonso, who completed his medical education at Nova Southeastern, has worked in emergency medicine, and has served as director of emergency medicine in Orange Park, and volunteered for many years in medical missions in Honduras, plus a local free clinic for working uninsured called Volunteers in Medicine. He recently received a Fulbright scholarship to work with a national university to establish the very first emergency medicine residency program in Honduras to begin in 2026. Dr. Alonso currently serves on the board of Florida chapter of Physicians for National Health Program and is a member of the Medicare for All Florida. Welcome, Dr. Alonso.
Thank you, Dr. Southwick. I'm going to try to share my slides here. So Dr. Southwick is a victim of part of the false advertising, which is what I'll be talking about today. Part of the reason that Medicare Advantage is now more than 50% of all enrollees is a very aggressive and deceptive marketing. One of the tools they use is reliance on celebrity endorsers. Here I list a few of them: the famous William Shatner of Star Trek, Lionel Richie, who's pictured there, multiple sports heroes. Unfortunately, just because you're famous doesn't mean you're honest. It's been well known that their aggressive marketing techniques is to kind of scare the person into, hey, you might get some extra money on Social Security, call our hotlines, they're waiting for you right now. So it's a very aggressive marketing using these celebrities. Another very deceptive and fraudulent is this one, is where they send you by mail a form that looks like an official government form, but it isn't. This one I just Googled online and it was hilarious. They actually promoted, and look at the quote there, this effective Medicare turning 65 mailer is designed to attract immediate attention of the target population for initial enrollment. So they're really preying on the elderly, which unfortunately a lot often start getting declining cognitive skills, are more susceptible to deception. It got so bad and there were so many complaints, I found out in doing this talk that the U.S. Senate Finance Committee had an investigation in August of 2022, and they found that in just that 1 year that they looked at, 20 to 21, there's a twofold increase in complaints. Here are a few of the highlights. That seniors, while they were shopping, were kind of aggressively accosted by salesmen, trying to have them switch from their traditional Medicare to Medicare Advantage, calling them multiple times, hounding them. Insurance agents selling a Medicare Advantage plan, telling them that the doctors that they currently have would be on that plan. And then when they switched over, it turns out they weren't, and they had to pay out-of-pocket costs. And another tactic that they use is the lure of additional benefits. Unfortunately, traditional Medicare does not have hearing, vision, or dental. And as you see in the slide at the top, most of these Medicare Advantage plans do offer that. But again, there's a lot of deception. For example, studies have shown that 25% of people who have traditional Medicare say they have trouble paying for dental care, yet 30% of Medicare Advantage who have dental plans say they have problems. Well, why is that? Well, the plans are so restrictive. The dentists are geographically so far away. There's caps of only $1,000, which I don't know if any of you have had any procedures. I'm not talking about just a cleaning, but a procedure, and you can easily exceed that. And a lot of these only cover preventative care. So, you know, if you need an implant or a filling, they're just not covered. So this committee found, and these are quotes, these are the words they use, that these are predatory actions, intentionally deceptive, quote, false and misleading marketing advertisements and fraudulent sales to undermine access to care. And I think this last part, the trust that the beneficiaries have in Medicare program. I am convinced that part of this is all a plan to slowly just not only privatize, but make people so frustrated with the government plans that they don't have any qualms with switching over to private plans, sort of like that effort to privatize Social Security in the stock market. I'm not going to talk too much about the commissions, but Dr. Southwick found out himself, unfortunately, is these salesmen get significant commissions, 2 to 3 times the amount if they sell you a Medicare Advantage plan than a supplemental, for example. And that commission gets renewed every year. You have to renew your Medicare. So if they keep you on Medicare Advantage, they're making significant sums, enough to pay their nice lifestyles. I found this interesting. They did a secret shopper call to Medicare Advantage agents, and then over 80% they gave false information or just outright lies. A common one was telling people that your drug would be on the plan even though it wasn't. And they would say, oh, don't worry, it'll get put on your plan once you switch over. The committee made these recommendations, but unfortunately, since none of these have teeth or enforcement power, I feel that the best solution is just to get rid of Medicare Advantage. And this is what we should and what we are fighting for. But these are the recommendations where they said stronger, robust rules and having people access better information centers. And that's all I have. Thank you.
Thank you so much, Dr. Alonso. My name is Kifayat, and I am a member of Students for a National Health Program at the University of Florida. Now, we have heard a patient experience from Dr. Southwick, and we heard about the marketing practices of so-called Advantage plans from Dr. Alonso. This brings us to a presentation by some of our leaders of the Florida chapters of Students for a National Health Program. What exactly is Medicare Advantage? Once you're on Medicare Advantage, why do you have to wait 12 months for a chance to return to traditional Medicare? Why do these private insurance Advantage plans delay and deny our care? I'm thrilled to hand it over to our presenter team, Patrick, Sam, Kita, and Shivsika.
Hey everyone. I'm going to share my screen right now. All right. Thank you so much for that great introduction, Kifayat, and congrats on creating officially the University of Florida undergrad SNAP chapter and getting incorporated. So congrats to you as well. So hey, my name is Pat Haley. I am a 4th-year medical student at the University of Florida. I'm joined by Sam, Gita, and Sirshika, and we're going to explain a little bit about Medicare Advantage or Disadvantage and tell you a little bit why it's a little bit more like Disadvantage. So before we get into some of the deceptive business practices that Dr. Alonso explained, we need to know the difference between traditional Medicare and Medicare Advantage. So under traditional Medicare, you have Part A and B. Part A is going to cover hospital insurance, and that's going to be like when you get admitted to the hospital or need to go to a skilled nursing facility. Part B is going to cover your outpatient care, labs, and durable medical equipment. Part D for drug is going to cover your prescriptions because unfortunately Part A and B does not cover drugs, and that's going to be private insurance that you need to supplement your Part A and B with. And Part G for GAP is going to cover all those in-between costs. That's also private insurance that we're going to talk about a little bit later. You can contrast that on the right with Medicare Advantage, which is also known as Part C. And basically what that does is it bundles A, B, and D with different supplemental benefits that you may or may not be able to cash in on, like Dr. Alonso explained. Basically how this works is that the Center for Medicare and Medicaid Services pays a fixed cost per enrollee to these private insurance companies to administer Part C. They are supposed to abide by normal Medicare rules, but they're allowed to use different out-of-pocket costs and utilization management that we can explain why it might be extremely detrimental to our seniors, including delays and denials of care, including referrals, networks, and prior authorizations. And with that, I'll pass it off to Gita.
All right, Pat, thank you so much for that wonderful introduction to Medicare and Medicare Advantage. I was told yesterday to bring the anger, so I'm going to bring the anger. I am angry and frustrated the fact that we as a society are letting ourselves be hoodwinked by these insurance companies into allowing our healthcare to be taken away from us. I am angry that our government is complicit in allowing insurance companies to make money off of keeping people underinsured. I'm angry that so many people seem content to put their hands up and say, oh, well, until something happens to them. So with that, let me tell you why you should also be angry about Medicare Advantage. As we've kind of alluded to, Medicare Advantage is a for-profit business that makes money off of old, sick people using the tactics on the screen and more. Namely, I want to bring your attention to lemon dropping and upcoding. Lemon dropping is a concept where healthier patients tend to go with Medicare Advantage since it's advertised as cheaper, and sicker patients tend to stick with traditional Medicare. However, funding dollars for Medicare travel with each patient, so money that could be spent on sicker patients exits the traditional Medicare pool and instead goes to Medicare Advantage. Medicare Advantage also uses upcoding to get paid for higher acuity diagnoses that don't need to be treated. This is a concept that a lot of people in healthcare are familiar with, but it's essentially where a diagnosis is listed as more severe or more acute than it actually is. And to be clear, Medicare Advantage companies were doing this behind physicians' backs. Pat, you can go to the next slide. This was exposed in a Wall Street Journal article recently where Medicare Advantage, who are private insurers, again, made $50 billion off of doing this. Next slide. Now, in traditional Medicare, the vast majority of physicians in the US accept it, as you can see illustrated on this slide. However, next slide. Over half of Medicare Advantage plans are HMOs, which tend to be restrictive, feature small networks, have little out-of-network coverage, and require referrals for specialist care. The average Medicare Advantage plan excludes over half of the physicians in the country. And physicians who treat patients with higher level of medical risk are less likely to be included in Medicare Advantage plans. Additionally, there's this concept of ghost networks where they identified that over 80% of listings for providers in Medicare Advantage plans were inaccurate or unavailable. And as Dr. Southwick kind of said, after being on Medicare Advantage for a year, you're basically stuck. Sam?
Not only do you have super restrictive plans, there's also a very high administrative burden when it comes to Medicare Advantage. For example, physicians cannot refer patients to their preferred locations because of the aforementioned network issues. So they have to go out of their way to find new specialists to refer their patients to. On top of that, Medicare Advantage has lots of prior authorizations that are required, which means physicians have to spend time that they could be treating their patients to instead deal with insurance companies to try and get their prior authorizations passed. And when asking a group of physicians to name the type of policy that is the most burdensome when it comes to prior authorizations, 46% of them said Medicare Advantage, while only 4% said traditional Medicare. And to talk more about these administrative burdens, only 2% of traditional Medicare's budget is spent on the administrative costs, which makes sense because you have one insurer and everyone knows all the rules for that, so there's no need to jump through hoops. Whereas with Medicare Advantage, on the next slide, up to 12 to 18% of their budget is spent on administrative costs. And this also creates additional costs for physicians because they have to hire people to specifically learn all the rules for all these multiple different companies and jump through all the hoops, get all these different prior authorizations passed, which can create up to 20% overhead costs, which again is taking money away from direct patient care. So knowing all this, you might think, why do people even choose Medicare Advantage over traditional Medicare? And Dr. Southwick touched on this earlier. A lot of these Medicare Advantage plans get people to join by advertising various supplemental benefits that aren't covered in traditional Medicare. But a study saw that 30% of those on Medicare Advantage actually don't end up using any of their supplemental benefits because it's so hard to access them. And until 2024, Medicare Advantage plans did not even have to provide any data on these supplemental benefits, which continues to show the lack of clarity that we have from these insurance companies.
All right, so as we've learned today, even though Medicare Advantage has all these issues, people are still signing up for it. So what are the other options we have? So on the right side, we see three main options for people enrolling in Medicare. The first is to just have traditional Medicare, but unfortunately, traditional Medicare is imperfect and you run the risk of basically being bankrupt if you have a major illness. The second one, as we've mentioned, is to sign up for Medicare Advantage. But as we discussed, you get stuck with all the flaws of private insurance and have to deal with all these pre-approvals. And the third option is to get traditional Medicare and add Medigap. This avoids dealing with private insurance companies while getting the coverage that traditional Medicare lacks. And from what we've talked about with doctors, this option seems to be the best one if you can afford it. Now, as many of you know, Medicare will face more difficulties if the current Trump administration goes through with the appointing of Dr. Oz as the administrator of the Center for Medicare and Medicaid Services. These two articles I've pulled up focus on how Dr. Oz's appointment they highlight the conflicts of interest that he would have in this position and how his policies would negatively impact Medicare. So basically, Dr. Oz has made it clear that he wants to expand the amount of people on Medicare Advantage, which would pretty much increase the amount of taxpayer money going into these private insurance companies. And it's also well known that Dr. Oz has major investments in pharmaceuticals and insurance companies, including as much as $600,000 in United Healthcare. And it's worth noting that under Dr. Oz's plan, that same company, United Health, is estimated to double its annual revenues. So we can move on to the next slide. So what is our solution? It's clear that this push for Medicare Advantage is not coming out of patients' best interests, but plainly out of monetary gain. And here's some things we can do about it. So first, as Representative Jayapal told us, there's a letter she's putting forward demanding more accountability from Medicare Advantage companies. Something we can do is ask our representatives to sign this letter to limit taxpayer money that's ultimately going into the pockets of these private insurance companies. And this also falls into PNHP's triple aim, which we see on the right side. The three parts of this triple aim are to, 1, end profiteering, 2, improve traditional Medicare, and 3, advocate for a single payer system. Secondly, PNHP is hosting a shadow hearing for Dr. Oz's hearing. This will take prior to the first hearing, and we don't have an exact date, but if you register in the link in the chat or just visit PNHP's website, you should see a QR code there, and we'll send you updates, and you do not need to be a medical professional to participate. Everyone's welcome. And yeah, those are the main ways we can work to fight Medicare Advantage. So yeah, that's it for our presentation. I'll pass it over to Dee.
Thank you so much to my colleagues. Thank you for each session. I'm pretty angry and fired up, but I will introduce our next speaker. Hello, my name is Devalda. I am a member of Students for a National Health Plan at Florida State University. It is my pleasure to introduce a video message from Congresswoman Cherfilus-McCormick, representative for Florida's 20th Congressional District. Born in Brooklyn to Haitian immigrant parents, she made history in 2022 as the first Haitian American from Florida elected to the U.S. House and the first Black woman to represent her district. She holds a Bachelor of Arts degree in political science from Howard University and a Juris Doctor from St. Thomas University School of Law. With experience as a former VP and CEO of a home health care company, she prioritizes healthcare and is a strong advocate for Medicare for All. She also supports Representative Jayapal's efforts to address concerns about Medicare Advantage plans. Now, as a proud and fellow Haitian, it is my pleasure to announce Congresswoman Cherfilus-McCormick and share her special remarks for tonight's town hall, since she could not join us, but she does have a video message for us all.
Hello everyone, I'm Congresswoman Sheila Cherfilus-McCormick, representing Florida's 20th District. Thank you to Medicare for All Florida, Physicians for a National Health Program, and Students for a National Health Program for hosting this important conversation. I'm honored to be a part of this vital discussion on reforming Medicare Advantage and ensuring Medicare is preserved for future generations. Let's be clear, Medicaid Advantage was sold to us as a cost-saving, efficient alternative to traditional Medicare. But the reality is that it's costing taxpayers approximately $100 billion more while providing fewer benefits and lower quality care to the very people it was meant to help. We must act now to protect our seniors and the most vulnerable amongst us, a mission I've been dedicated to since I stepped into office and will continue to deliver on. Last Congress, I supported legislation to enhance care for our veterans who rely on VA services and work to expand access to life-changing treatments for Americans struggling with obesity. I'm also a proud co-sponsor of the Medicare for All Act and the state-based universal health care. These are the kinds of reforms we need, systemic changes that prioritize patient care, not corporate profits. All Americans deserve a system that puts their health first. And I will continue to fight to ensure that Medicare remains strong, fair, and accessible to all. Once again, thank you all for being here this evening.
I am so grateful that we have the video from Representative Cherfilus-McCormick with that message. And I just want to recap some of what we've heard today. In addition to words like grift, scam, lies, that kind of stuff, what we know is that corporations are chipping away at our public health programs. And they're doing it all just for the ever increasing profits that they want. Insurance corporations definitely have a conflict of interest. They are only expected to be loyal to their shareholders. They are there to make money for their shareholders. And what that means is that the rest of us might not get the care that we need, even though we are paying more and more out of pocket. I don't know about you, but I get angry at that as well. So it's a big deal for us. So what we want is our North Star, improved Medicare for all. You've heard of some of this already. It means that the current traditional Medicare, which is not privatized, it's public, it would be improved to include things like vision, dental, medical devices like hearing aids, prescription drugs, and all that more. An improved Medicare for all would include none of that cumbersome pre-approvals that private insurance companies really like to put in place to make it more difficult for us to receive the care we need. Remember, they make more money when they deny your care. And so that should make you angry. It certainly makes me angry as well. So Medicare for all means that virtually all kinds of care would be fully covered with no copays, no deductibles, no out-of-pocket costs. And that would be that there would be no more financial barriers to the care that you need. Medicare for all is the bill that would expand it. Your eligibility age would go down gradually. The way the act works, eventually it would go down to 0, which would put all U.S. residents would be covered cradle to grave, and that is really what the improved Medicare for all program would mean. It would be a public program. Its only function would be to provide care for everybody. And of course, that would make me happy, not sad. So what we know is that most Democrats have already signed on to the Medicare for all program, and most Americans, poll after poll, show that most Americans want that too. But we won't get there. We won't get there to reach that ultimate goal of improved Medicare for all as long as corporate health insurers continually chip away at our traditional Medicare program, and all because they want to privatize every single bit of it. So Now it's time. The time has come for us to actually take action. And I'm hoping that you will see in the chat a link to something that we can do just tonight. It'll take 2 minutes. It won't take long at all. And if you get to that chat, that link in the chat, or you can use the QR code that you see here, or you can use the URL that's there. If you click on that, it will take you to a platform that we use called Action Network. This page is really easy to take action. You put in on this right-hand side here, you put in your name, your email address, and your address, and it will automatically take you to the U.S. representative that is your representative. Mine is Kat Kamek, and when I do this, this is what I get. It says, write to U.S. Representative Kat Kamek. And so there is where it's already been written for you if you want. It says here's your message. When I do this myself, I'm going to include something more at the beginning so that everybody's emails won't be exactly alike. But I'm just going to tell you, if you have a story about how Medicare Advantage has actually been a disadvantage to you or somebody that you know, this is the place to put that in there. This is the place to tell that story. And so we definitely want to get that taken care of. But the main part of the email is right there. And when you get it all done, and if you're good with that, you hit that square, that rectangle that says send letter. I'm hoping that while I'm talking, you're kind of getting that going right now and doing that same thing, and then hit that button that says send letter. I would really like for you to do something else for us tonight. I would really like when you hit that send letter and it's all done, easy peasy, took a couple of minutes, I would really appreciate it if you would put in the chat, sent the email, and that would help motivate the rest of us, inspire us to keep doing something. We need to be able to do something. If you are having any problems, just let us know in the chat. Our Medicare for All Florida people will help you. If you have any difficulties, they'll private message you and help you get to where you need to be. Maybe there's another link that helps you if you're not from the state of Florida. So I want to spend just another second or two to make sure that you know that you can hit the link. You could go to that URL. You could do that QR code, and that would take you to this email. And that would be our action for tonight. So don't forget to hit that send the email thing in the chat. So we have come to the part where we're going to wrap things up for tonight, but I briefly want to go over some of the ways that you can continue to be active about all of this. Medicare for All Florida, the Students for a National Health Plan, the Physicians for a National Health Plan, they have scheduled a lobby day in Tallahassee on March 13th. You can use that QR code to sign up for that. It really gives you an opportunity to let your legislators know in person what it is you want. If you're in Florida, we're hoping that we can get past the Healthy Florida Act, and we're also hoping for a bill that would limit the copay that one pays for insulin to $35 a month. So if you go to lobby days, you can actually help make that a reality. Medicare for All Florida, we're everywhere. We table everywhere. And every place that we go, we try to get people to sign the petition to put Medicaid expansion on the ballot for the 2026 ballot. And we also have a petition for Medicare for All for our U.S. senators. But here is an example of other things that when we go out, we go to places like Orlando for Earth Day on April 19th, Kissimmee Pride on May 31st. You can go to our website and find all the information that you need there. We have monthly all-state meetings, and I'm really, really happy about those because we've had so many good speakers. But I'm especially happy about the one that we're having on March 19th. Yet many of you know that there is a special election coming up on April 1st, and it's a very big election. And we have managed to get two people who are running for office in that election on April 1st to come and talk to us about healthcare and their other ones. Gay and Josh will be there, and I hope that you will sign up to join us at our monthly meeting. So that's a very important one. So here we are. We've reached the end of our meeting. We know that we want to thank all of our speakers and our presenters. I love our young people. These are medical students who, as young people, understand how important it is that we do something for their future as well. They may not be on Medicare, but they see what's going on in those programs. I am especially proud of the fact that Representatives Jayapal and Cherfilus-McCormick have joined us with their video messages. It's not that easy to get them to do that kind of thing, and I was so proud of the fact that they were able to do it. But most of all, I'm proud of you. I'm proud of you for being here. I'm so grateful that you were here. If you've sent an email message to your legislator to say sign on to that to fight back against privatization, I'm hopeful that you are finding that this has been informative for you. Pretty soon you'll get an email from us that'll go over all of this stuff and help give you information that you may need. And I'm very happy about that. But so you don't have to worry about that. You'll get some information back from us. But here's the big deal. I want you to know, I heard someplace that action absorbs anxiety. And if you are mad as hell like I am, and if you're angry and you know it, take action. It will absorb some of that anxiety and it will make you feel good about all that you can do. So thank you so much, everyone, for being here. Be safe and have a very good night. Thank you.